Hi, this is David Schaefer, the American Retirement Advisor. This segment is on how to choose a Medicare plan. If we look at original Medicare, it has two parts, Part A and Part B. Part A has no premium at this time. Part B has a premium, and if you're joining Medicare in 2011, it's $115.40 or more, depending on your income. After we've made the decision to accept Medicare Part A and Part B, the next choice is we need to decide if we're going to supplement our Medicare or transfer our Medicare benefits to a Medicare Advantage company. So, to look at that more closely, if you have benefits from work, either as an employee or a retiree, you're probably going to need to have Medicare Parts A and B, but your plan description will tell you exactly. The other choice when supplementing your Medicare benefits is a Medigap plan. That is truly a Medicare supplement where you have Medicare plus your Medigap, and that does a really good job in eliminating any surprises in your medical costs. The other option is to transfer your Medicare benefits to a Medicare Advantage plan, and in many areas the benefits are extremely rich and very cost effective. The other option may not be available to you, but it's for folks with Medicaid. In many cases, the states will contract with a Medicare Advantage company to take those responsibilities away from the state so they can just pay one monthly premium to take care of you. So if we're looking at this as a whole, you can either supplement your benefits or you can transfer your benefits away. In the next slide, we'll get into more detail. As you can see, there are many companies that offer both Medigap and Medicare Advantage plans. To compare and contrast Medicare supplements, that's Medicare with a Medigap plan, and Medicare Advantage plans, we really need to talk in generality. It's been my experience that most people are concerned with maintaining their current physician relationship. With Medicare and a Medicare supplement, that's not even a question. Any doctor and any hospital with a license will be paid by Medicare. With Medicare Advantage, you need to check the network prior to signing up with a plan to make sure you can maintain that. As for copays, with the Medigap Plan F, that's Medicare and a Medicare supplement, there is no copay for any Medicare provided service. For Medicare Advantage, copays typically range from $0 to as much as, say, $1,500 for a hospital stay, with doctor copays somewhere in the $10 to $15 range. When it comes to deductibles, the Medicare supplement has no deductible for Medicare covered expenses. With the Medicare Advantage, you can expect to pay from 0 to 20% for any service that you receive. As far as out-of-pocket costs, there are none for Medicare covered expenses with the Medicare supplement. And with the Medicare Advantage plans, you can expect to pay as much as $6,700 out of pocket on an annual basis for Medicare covered expenses. When we discuss prescriptions with the Medicare supplement, you need to purchase a separate Medicare Part D, D as in drug, plan, and in most areas there's 20 to 30 different plans to choose from, offering a great deal of choice. On the Medicare Advantage side, the prescription drug benefits are included. The reasons that people select plans are as follows. The Medicare supplements are typically selected because of freedom of choice. Use any doctor or hospital in the United States without restrictions. There is no copay or deductible for Medicare covered expenses, and you don't need a referral from your primary doctor to see a specialist. The reasons people select Medicare Advantage plans are typically low monthly premiums or simplicity of use, and of course the drug plans are usually included. As for calculating your total costs for your Medicare plans, the left column being the Medicare and supplement, and the right column being the Medicare Advantage plan, Medicare Part A is still free for just about everybody that's worked 40 quarters in the United States. Medicare Part B is based on several factors. 1, income. 2, when you start your Medicare. Medicare for 2011 is $115. Please understand that premiums do vary greatly by zip code and by county. The premium of $111 for the Medigap Plan F is accurate at the time of publication in Maricopa County, Arizona, as is the Medicare Advantage premium of Part D of Medicare is the prescription drug benefit. The average cost of a Medicare Part D plan is $35. With Medicare Advantage plans, the drug programs are typically included, so there would be no additional cost. As far as the total monthly premium, the left column of $261 per month and the right column of $116 a month are fairly accurate estimations of what you can expect to. Once again, this is David Schaefer, the American Retirement Advisor. I hope you found this information informative. Now that you have the general information to choose a Medicare plan, the next step is to get specific. Register today and we will provide you with our complete bank of research, which includes our side-by-side comparison guide for every Medicare supplement plan, our side-by-side comparison guide for every Medicare Advantage plan, as well as complete access to all of our updates. We'll even throw in our monthly newsletter as a bonus. So go ahead and register below and you'll have instant access to all of this information to save you hours of time comparing